Hi.
Okay, vanilla or chocolate, Ford or Chevrolet, Dr. Phil or Oprah. Life is full of decisions every day, big or small. I'm here hopefully to make a path for you or any future parent out there for one of the biggest decisions of parenthood, having a C-section or a natural birth. I'm informing you all to choose wisely, whether a cesarean or giving natural birth. Everyone has different situations. However, if you have a choice, I want to explain why natural birth is the way to go. Here are some facts to think about. First off, natural delivery has a quicker recovery. After a C-section, you are looking at weeks and weeks of recovery time. Natural birth helps prepare the baby, such as forming the head, pushing the fluid out of the baby's lungs, and introducing the baby to good bacteria as it passes through the vaginal canal. My sister and best friend both had a C-section, and they were devastated that they were so drugged and don't remember anything after the birth or even a little while after. If you are afraid of labor, then maybe you would probably prefer a C-section. Labor is nerve-wracking, and the length of time it takes and the fear of the unknown is very stressful. However, many men and women make rational decisions when their spouses or themselves are in very much pain, as in giving birth. And they may regret it hours later. My personal experience with Mia, I was going in, I knew I wanted an epidural because I was scared of the pain that came with labor. I also thought I would possibly want a C-section because I didn't want the pain of vaginal delivery. However, once the day came, I was a rock star. I was laughing and smiling until they broke my water, and the only time I cried was when they're giving me my interthecal, and I was afraid of how huge the needle was. In the end, I don't regret having a natural birth, but I do regret the medications. If you feel that you can't deal with the pain and length of time, they suggest a C-section if the doctor okays it. A lot of women think that just because you had a C-section with a previous child that they have no other choice but C-sections for the rest of their birthing experiences. However, this is not the case. According to the article I found on American Pregnancy Association, knowing that 90% of women who have undergone cesarean deliveries are candidates for VBACs, which are vaginal birth after C-section. Statistically, the highest rate of VBACs involve women who have experienced both vaginal and cesarean births and if given the choice have chose to do it vaginally. I fear that a lot of women don't know the best birth plan to go about when having a baby. Or even worse, they feel like they don't have a choice. Well, everybody, you do. And I hope steer you in the right direction of the decision you will make when the wonderful time comes. And I can't stress enough how important it is to go in with a plan. Just remember, not all things go accordingly, but it is very important what is best for you and the baby, and natural is always best. Thank you.